Hey guys, Callum with Holistic Foot Clinic here. And now that we've established what kind of injuries commonly happen to the ankle, and that's obviously sprains, strains and fractures, I'm really going to talk about what you do in that moment when you maybe have that rolled ankle, okay, or maybe when you're just starting to notice pain coming on. Now this is the big difference between an acute injury and a chronic kind of, strain that happens slowly over time. So if you have just suddenly injured yourself, whether from a hit or a rolled ankle, very likely you're going to be getting large amounts of pain. You might see swelling, you might see redness. The most obvious thing to do, which believe it or not, some people don't always, or a lot of people don't always, is stop. Okay, so if you're playing sport and you think you want to push through it, you can, but you're just going to make it worse. So that's obvious, but some people don't necessarily think about how much worse they can make it. So obviously stop. And this leads into what we call, obviously, rest, continuing to not push it and stay off that foot or ankle as much as you can. Okay, the next is, if it is red hot and swollen, then yes, we want to cool it down, get some ice on it. General rule people say is 24 to 48 hours. Really, if it's red, hot and painful, you're wanting to ice it. Once it does ease up, then maybe you can consider swapping to heating to do the reverse, get more blood in and heal it up. But that can be a hard thing to assess sometimes, which is where maybe a doctor or podiatrist might need to have a deeper look. And then while you're resting, a really easy thing to do, kick your legs up, okay? Because the higher up your foot is, more of that bad blood can just stay out of there and it can just let it cool down and relax. When you're sleeping, if it's really bad, stick a pillow underneath your ankles and get that up. Next, which not everyone does, is kind of compression / bandages. Usually if your ankle's swollen up, puffy and red, you're probably not going to go slipping a tight compression sock or ankle brace on it. That'll probably hurt. But sometimes people use some firm bandage wraps around the ankle and foot area just to kind of compress any of the swelling that is there. That can be really good. Also really good just to hold it in position. Some people do like taping immediately post-injury. I don't necessarily think that's necessary. Sometimes if you know what you're doing, yes, that's the main part. If you tape an ankle correctly, even post-injury, doesn't mean you can go running around, but it does mean if you have to be walking, yeah, it can help stabilize and offload some of those joints pretty well. But I'd say use that with caution. Next is really if it is bad enough, and you should see this kind of injury ease up within 2 to 3 days. And by ease up, I mean go from being shockingly painful to at least, oh, that's still a bit painful. If you stay at the shockingly painful level, then you may be needing, at the worst, emergency ward. Obviously a fracture where you can see a bone sticking out needs a bit more treatment than just a bit of compression wrapping. But maybe you would consider something like a cam boot or a walker that we use, which is pretty much something that offloads that pressure as you're walking through, okay? Which allows you to rest the foot while still continuing activity. Now, if it's a chronic problem, then really we're kind of leading you straight into the rehab motion, because we don't necessarily, unless it's gotten that bad, we don't necessarily have to go icing it or putting you in a boot straight away. However, whether acute or chronic, if the problem and the injury is bad enough, yeah, sometimes we have to put someone in a boot or just get them relaxed or even recommend them to surgery for at least investigation if it's pretty bad enough, okay? So in future videos, we're going to go into then how we begin that rehab and hopefully then beyond, how we prevent these things coming back in the future. All right, so I hope that was a bit of help. Hopefully if you do roll your ankle, especially with some of the sport season coming in, you'll know how to deal with it. Until then, take care guys, keep on walking.